All right, so Pharmacist Interventions Part 23. These are from yesterday and today. I had a patient yesterday, or a caregiver, picking up Abilify Maintena, 300 milligrams, which is an injectable Abilify. It's an antipsychotic. It was flagging against Zyprexa and oral Abilify. So it had on the file that patient was on 2 other antipsychotics, oral formulations. So I asked the caregiver, patient was not on oral Zyprexa, but they had previously been on oral Abilify to assess tolerability. That's normal. It's recommended to be on the oral version before you do the injectable to make sure the patient's tolerating it. So I noticed the dose was kind of low. It was 1/2 of the 5 milligram tablet. So the patient was actually on 2.5 milligrams. So I just mentioned it to the caregiver to say, hey, this is kind of low. We're treating a patient with bipolar who was having psychosis, and it's recommended to pretty much be on the dose that you're gonna have therapeutic levels with if you're doing an injection. So a more appropriate dosage would have been like the 10 to 15 milligrams if we're at accurately wanting to assess tolerability. But that's just something I mentioned. It also requires an overlap too. Caregiver was not aware that it required an oral overlap, is what we call it. So the lead-in is when you take something up to the injection, you inject it.